Let's now go back to Gianna, who is with our expert panel right now. And Gianna, you just got some more questions from viewers.
Yes, we've been getting them all day for weeks now. And once again, joining me now is Dr. Olayemi Osiyemi, who specializes in infectious diseases, Fennell Siegel, an infectious disease consultant. And we also have Dr. David Dodson, an infectious disease specialist. So, of course, we want to go to our questions now. So, Alyssa posted on our Facebook page, and she asks, please address how to handle items and packages that we receive from China. I think this is interesting. Dr. Osiyemi?
Well, I think anything you receive from China, I wouldn't worry too much about it because the virus is probably not going to be alive by the time you get that. But I would still, recommend washing your hands after you unpack the package. Just make that a routine thing to do.
Perfect. And Fennell, let's talk about this. Thomas tweeted this question to us. I'm 71 years old, have COPD, and have tickets to the Red Sox and Astros this Saturday. Do the experts think I should be going to this game? Do they think it's a bad idea? What do you think?
Well, the CDC has talked about and recommended social distancing, which means keeping away from large crowds, particularly for people that do have underlying diseases. And this gentleman has COPD, which is a lung disease. It's chronic, and definitely puts him at a pretty high risk for acquiring the coronavirus. So he would fall under the social distancing recommendation. So I would say if you can stay away, better to be safe because you really are taking a risk.
Perfect. And Dr. Dodson, let's start with you as well. Let's talk a little bit about very few people we know are being tested. So how do you even know if you're a carrier, especially if you have a mild case, which is what we're hearing about a lot, that people have a mild case, some people don't even know they're sick.
Well, that's exactly the clinical problem that we all face, because the symptoms of influenza and coronavirus and other upper respiratory viruses are all the same. So the paradigm is when people come in with a respiratory virus, we have a test for the flu, we can rule that out, we can look for bacterial infections, but if the flu is negative, then we're kind of stuck between whether it's just a regular virus or whether it's coronavirus. Now, commercial labs in Palm Beach County are coming online with test kits, so they should be available in the next week or two. So we will be able to answer that question, assuming the test kits are reliable. But it's a difficult question right now.
It's very difficult, yeah. And Dr. Osiyemi, does the senior pneumonia shot protect people from the coronavirus?
Well, pneumonia vaccines are designed against bacteria, which doesn't have any effect on coronavirus.
Right.
So it would not have any effect.
One question that I've heard about is, a lot of times the flu or a sickness can turn into pneumonia. So if the coronavirus can turn into pneumonia, would the pneumonia shot work if it turns into something like that?
Well, I think that if you're a high-risk individual, you should get a pneumonia vaccine regardless.
Okay.
What we do know from the Chinese experience is that most people who develop severe coronavirus do not develop secondary bacterial infection. That we do know. But having said that, this is a season where we have flu. People are getting secondary pneumonia infection. So everyone that's at risk should get a pneumonia vaccine.
Perfect. And Fennell Siegel, let's talk a little bit about those underlying illnesses. We touched on COPD. What are some other ones that are concerns?
So any disease of the lungs, particularly chronic illnesses, including asthma. And that's where, even although we're seeing the more severe cases in people over the age of 60, for those people that are younger that have a history of asthma, it's really important to understand that the risk is higher. Congestive heart failure, cardiac problems that are seen as comorbidities to any type of viral infection. And then, of course, we're very concerned about the immunocompromised patients. So those are the patients, cancer patients, patients that have a suppressed immune system, that are on chemotherapy. I think that they are the ones that we really have to consider for social distancing and to be extremely cautious with hand hygiene, etc.
Absolutely. And this question is for all three of you, but what do you all think about the reaction from the general public? Of course, we've seen a lot of panic, and I think we also have touched on some people, it's one of two things, panic, or some people are like, oh, it's fine, if I get it, no big deal. But I think one of the most important things is if you get it, you may not have serious symptoms, but then you could transfer it to a grandparent or somebody who may. So what do you think about the general public's reaction to the coronavirus?
Well, we've had many epidemics come and go, and what happens when you have a new agent that people are afraid of, you have to manage the epidemic of the disease, and there's also a concomitant epidemic of fear. And you have to, and the public health authorities and the government have to manage both of those epidemics simultaneously and well. So the antidote for the fear part, and I'm not a psychiatrist here, but it's facts. So it's listening to the scientific opinions and then acting accordingly. And that's the best thing you can do.
Fennell, what do you think?
So I think it's really interesting that as an infection prevention consultant, that's the work that I do. I've had numerous people reaching out, actually clients of mine that are healthcare facilities, that's who I consult for, and personal friends, neighbors,
Right.
etc. And I think that unfortunately what happens is, as Dr. Dotson says, when it's a new virus or a new condition, then there seems to be a lot of misinformation that comes from these really strange sources.
Right.
And at the moment, there's something going around about using zinc lozenges, but laying on your back and sucking on the lozenge on your back, and that will kill the coronavirus. I'm just giving an example as misinformation. I don't want that to be misconstrued as the next remedy for coronavirus. So I think it's really important, as Dr. Dotson said, to make sure that we get our information from credible sources, and that's the advice that I'm giving is don't look at those emails that are going out or the Facebook posts. Stay with the CDC, the WHO, Dr. Fauci from the NIH.
Perfect. Thank you all so much. We really appreciate it. And of course, we are still taking your questions on Facebook and all of our social media platforms. So if you're out there and you have a question, you need something answered, go ahead, reach out to us. Please send them to us, and our panel will be here throughout the night.